introduce to you our two experts.
It is my pleasure to share with you the new update to the living guideline, the WHO living guideline on COVID-19 and therapeutics. This is the 10th update of this guideline, and it will have two new recommendations in it. The first is a new recommendation for the use of nirmatrelvir, ritonavir, also known as Paxlovid, in patients with non-severe COVID-19 at highest risk for hospitalization. This is a new drug. Nirmatrelvir inhibits the SARS-CoV-2 protease and thus stops viral replication. It is co-administered with ritonavir, and ritonavir is an HIV protease inhibitor that boosts the effect of the nirmatrelvir, but it itself does not exert any antiviral effect against SARS-CoV-2.
And Lisa Hedman, Technical Officer.
The second recommendation is an update on the remdesivir recommendation, which we have in the past. Previously, we had a conditional recommendation against the use of remdesivir in all patients with COVID-19, regardless of disease severity. Now, with the recent publication of the Pine Tree trial, we have updated our recommendation, and we have a conditional recommendation for its use in non-severe COVID-19 patients, those at highest risk.
That has been secured for low and middle.
It is extraordinarily important to do prevention, preventing people from getting SARS-CoV-2, from developing severe disease, from death, and I think the vaccination is one of the key interventions for prevention. So this does not replace, these therapeutics do not replace vaccination. They just give us another treatment option for those patients that do get infected, that are at higher risk, like we've described, those patients with chronic conditions, those patients that may be immunosuppressed or of an older age and are not vaccinated. Then the benefit in them, we do think, is significant and can reduce admission to hospitalization. So I would not look at it as an alternative to that.
Lisa Hedman will also say a few words.
Now that there's a new medicine out there, I think there's always the second question, which is it available? Can we get it? And that question is always a little bit more complicated than it sounds. So actually, nirmatrelvir ritonavir is actually already available in several high-income countries, as well as in some upper-middle-income countries and some lower-middle-income countries. In these cases, it's been delivered under bilateral deals that the countries have negotiated directly with the manufacturer of the originator product, which is Pfizer. So if you look at this broadly and say, well, what does global availability look like? The deals right now that are reported in the public domain, they show a total that appears to be within Pfizer's production capacity, which they've estimated to be approximately 80 to 100 million treatments per year. But that said, not all deals are reported in the public domain. And we're aware that there's several large procurers, including 2 multilateral deals and a couple of countries that could be significant. So ultimately, those amounts could actually strain supply in the short term. So WHO is monitoring this closely and is working with its partners really to make sure that low and middle income countries, those with the most limited purchasing power in this market, have access to the medicine. That includes a supply agreement that's been signed with UNICEF that secures 4 million doses.
Conference until 0001.
Generic versions of this product are not yet available from quality assured suppliers. There is, however, a licensing agreement through the medicines patent pool, which has been signed by several generic companies with the originator company, and some of those generic countries have already expressed interest in having their quality approved through the WHO pre-qualified system. Some of those companies we know are already starting to produce, and they have license agreement that facilitates distribution to approximately 95 countries.
Doing for vaccines, right? And so
we're aware that some countries may not have a deal in place with the originator and that they may not necessarily be covered by that list of 95 countries in the Medicine Patent Pool licensing agreement. And so we are encouraging expansion of that list to make sure that we can ensure equitable access across, really across any country that wants to include this in their treatment arsenal against COVID-19.
Thank you very much, Fadela. Thank you for this brief.